2021 was the final year of implementation of the UN Multi-Country Sustainable Development Framework 2017 to 2021, signed by Belize in December 2016. The UN worked through the framework and country plan to support Belize to actualize the Sustainable Development Goals and National Development Goals in a year in which the response to the COVID-19 pandemic was a priority. The principle of the MSDF is leaving no one behind, and that could not have been more evident in the UN system's response to the COVID-19 pandemic. The pandemic plunged the world into a humanitarian and socio-economic crisis which affected all areas of life. In response, the United Nations in Belize quickly adjusted its development actions by formulating the Socio-Economic Response and Recovery Plan and the COVID-19 Impact Assessment. The Response and Recovery Plan articulated the UN's contributions towards mitigating impact and supporting national efforts in the face of COVID-19. It represented a first proposal by the UN for a comprehensive response based on people-centered approaches. The initial program made available $5.42 million needed to mobilize new projects. It was later incorporated in the annual country implementation plan, which led to key program interventions and results, such as the Multi-Partner Trust Fund COVID-19 project, designed to support low and middle-income program countries in overcoming the health and development crisis caused by the pandemic. The fund's assistance targets those most vulnerable to economic hardship and social disruption. In Belize, the program ran an extensive communications campaign to reach vulnerable populations as well as the general public with information on how to access COVID-19 related health care. It reached 206,435 people, or 49% of the country's population. The impact of these outputs were significant. 27,731 received pediatric services. 17,136 expectant mothers received prenatal care. 1,870 received antenatal care. Also through the program, 70,252 routine vaccines were administered, and 27 mobile clinics provided essential sexual and reproductive health and family planning. The India-UN Development Partnership Fund project for COVID-19 response is a dedicated facility within the United Nations Fund for South-South Cooperation. In Belize, the fund aimed at strengthening the response capacity of the health system to COVID-19 through the provision of key medical equipment, improving accessibility to local healthcare services, and increasing awareness of the prevention, response, and recovery among vulnerable urban and rural populations. The COVID-19 pandemic response proved the importance of partnerships with the government of Belize, civil society, and the wider development community. 15 UN agencies, funds, and programs collectively and effectively contributed to the 4 strategic priority areas in Belize. 1. An inclusive, equitable, and prosperous Caribbean. 2. A healthy Caribbean. 3. A safe, cohesive, and just Caribbean. 4. A sustainable and resilient Caribbean. Pillar 1. An inclusive, equitable, and prosperous Caribbean. UNICEF successfully supported the strengthening and implementation of water, sanitation, and hygiene, WASH, standard operation procedures in schools and communities with the work of the WASH multi-sectoral body, which includes ministries of health and education and other key stakeholders such as the Belize Red Cross. Over the past years, UNICEF's support reached over 5,000 students, including 2,500 adolescent girls with menstrual hygiene management and over 4,500 people in communities. UNHCR, IOM, and UNICEF provided technical assistance to the Belize Vital Statistics Unit and support to vulnerable families to ensure provision of birth registration and implemented mobile centers in 6 refugee and migrant hosting communities. On-the-spot birth registration, legal advisory, sexual reproductive health, and psychosocial support services were provided. The Food and Agriculture Organization also provided support to enhance trade in agriculture and fisheries products, food and nutrition security, promoting sustainable and resilient food systems, and food safety and quality. The government also re-engaged with the International Fund for Agricultural Development and Green Climate Fund on the Resilient Rural Belize program under a 6-year, $20 million blended finance facility. The program aims at minimizing the impact of climatic and economic events on rural small farmers, while supporting sustainable market access for their produce. Pillar 2. A Healthy Caribbean. Pahohu and Ministry of Health and Wellness implemented the Smart Health Facilities project, supporting the assessment of health facilities using the Hospital Safety Index, Green Checklist, and Emergency Preparedness and Response. The retrofitting of 11 health facilities in Belize to be climate-friendly and disaster-resilient, as well as the training of health personnel and first responders in disaster preparedness and response, with support from United Kingdom Foreign, Commonwealth and Development Office and the European Union. Pahohu, together with UNICEF, also supported the national planning and deployment of COVID-19 vaccines through the COVAX facility. Pahohu also supported malaria elimination and certification and the control of vector-borne diseases. Between 2010 and 2021, Belize achieved a 100% reduction in local malaria cases, 150 cases to 0 cases, with its last case reported in December 2018. The focus is now on the prevention of the reintroduction of the disease through early detection, prompt treatment, along with good coverage of preventative measures such as mosquito nets distribution and indoor residual spraying to maintain 0 local cases even in the midst of the COVID-19 pandemic. Belize is expected to receive malaria-free certification in the late 2022 or early 2023. As Belize's principal recipient of the Global Fund to Fight AIDS, tuberculosis, and malaria, UNDP administered some $2 million worth of investment for capacity building and strengthening of Belize's health sector. Global Fund supported key national successes, including the development of national laboratory capacities, allowing for decentralized testing, the expansion of core ministry capacities for epidemiology and HIV response, and the strengthening of non-state HIV support networks. Pillar 3. A safe, cohesive, and just Caribbean. UNHCR handled the sensitization of the local population to reduce stigma against persons in need of international protection. UNHCR partnered with local influencers such as Marlene Cuellar and Chef Sean Quillen, who lent us their voices and faces as they told the stories of asylum seekers living in Belize through a video series. These videos were shared across their social media pages, and it helped to shed light to the local population on who refugees are and the importance of accepting these people forced to flee into our communities. UNHCR advocated for legal adjustments and policy changes for asylum seekers. UNHCR also established the Asylum Seeker Resource Center to provide safe and accurate information about assistance and protection of asylum seekers and refugees, and as a service to facilitate applications for asylum to those who qualify. Women in the security forces could enjoy increased protection from sexual violence as a result of the Spotlight Initiative, which supported a joint sexual violence response program and action plan developed for implementation with the security forces. Information technology capacity of the judiciary was strengthened to improve existing systems of data gathering and management as well, to allow citizens greater access to justice during the COVID-19 pandemic. Pillar 4. A sustainable and resilient Caribbean. UNDP Belize works to support national efforts to build a sustainable and resilient Belize. Climate change, disasters, and environmental degradation all have adverse effects on sustainable development, livelihoods, and the economy of Belize. Through its programming, UNDP supports an integrated natural resource management approach grounded in society-nature interfaces, linking productivity, the environment, and development. UNDP program delivers targeted capacity building of resource managers and management institutions, enabling national response to inclusive and sustainable solutions for the conservation and the responsible use of Belize's natural assets. During the past cooperation cycle, some $10 million were mobilized and delivered at both national and community levels, supporting actions that targeted the sustainable management of Belize's natural capital, climate change, and biodiversity institutional building, climate change adaptation and mitigation actions, the promotion of blue-green jobs and livelihoods, and disaster risk management. The establishment of and continued strengthening of both the National Climate Change Office and the National Biodiversity Offices, as well as the development and enactment of key associated national strategies and policies, are evidence of these works. As the country moved towards its reopening following the pandemic closure, UNDP, partnering with the Office of the Prime Minister, with support from the Office of the United Nations Resident Coordinator, delivered through its SDG Investor Maps and Impact Facilitation Window, a portfolio of 16 investment opportunity areas in Belize. This work continues with the development of IOAs supporting the delivery of Belize's national determined contributions towards low-emission development target, as well as identifying key investment opportunities within the agriculture sector. Under the MSDF 2017 to 2021, the first of its kind to be implemented for Belize and the Caribbean, the United Nations Country Team, UNCT, in Belize was able to deliver programmatic and operational activities efficiently and coherently against the 4 strategic pillars and 8 outcomes of the framework. 2021 was also a year of planning for the UN. Based on an in-depth situation assessment for Belize and the region, along with broad-based consultations, these informed the design of the new cooperation framework, which became a reality for 22 countries in the Caribbean. In December 2021, Belize signed the new Multi-Country Sustainable Development Cooperation Framework for 2022 to 2026. Under the UN reform process in 2021, we learned that partnership was integral to the success of the UN cooperation in Belize. UN agencies work together with government and civil society in these various undertakings. We could not be more pleased with the results as we look to strengthen our joint actions. On behalf of the UNCT in Belize, we are grateful for the continued partnership with the government of Belize, the development community, and the people of Belize.